Hi everyone, welcome to Psych Bites from the Academy, your source of the latest psychiatry and neuroscience news from around the world. I'm Sanil Rege, consultant psychiatrist. In this edition of Psych Bites, we'll be looking at three fascinating studies. Firstly, the link between sleep and life expectancy. 2, the brain changes in premenstrual dysphoric disorder. And 3, is procrastination linked to poor health outcomes? So without further ado, let's get started. Our first bite comes from Nicole Napoli and Thai-An Nguyen at the American College of Cardiology. Their research looked at sleep habits and cardiovascular health, linking that to life expectancy. So the big question here is, are sleep habits linked to life expectancy? Now, this is a really fascinating study because the study analyzed data from 172,321 participants who completed the National Health Interview Survey between 2013 and 2018. So the study specifically assessed 5 different factors of quality sleep using a low-risk sleep score. And these factors that they included were: first, ideal sleep duration of 7 to 8 hours a night. 2, difficulty falling asleep no more than 2 times a week. 3, trouble staying asleep no more than 2 times a week. 4, not using any sleep medication. And 5, feeling well rested after waking up at least 5 days a week. Now, this is really interesting because it's looking at the overall sleep cycle. It's looking at not only the different sleep phases, but also looking at daytime functioning. And this becomes extremely important when we're thinking about sleep. As psychiatrists, it becomes crucial to examine sleep and recognize the neuroscience behind sleep. A recent really fascinating paper that looked at the symptoms across all DSM diagnoses found that 231 symptoms overlapped across the range of diagnosis, i.e. they repeated a total of 1,022 times across all DSM categories. And guess the symptom that was most repeated: insomnia. So it tells us that sleep plays a crucial role in psychiatric disorders, but importantly, it acts as a transdiagnostic marker. Now, we've got a detailed neuropsychiatry of sleep review on the PsycScene Hub, but we also have a course coming up on insomnia and neuropsychiatry of sleep, both linked on the Academy. So what did the results show? The results showed that young people with better sleep habits were less likely to die early, and approximately 8% of deaths from any cause could be attributed to poor sleep patterns. The researchers found that individuals with all 5 favorable sleep factors were, and this is so fascinating, first, 30% less likely to die from any cause. 2, 21% less likely to die from cardiovascular disease. 19% less likely to die from cancer, and 40% less likely to die from causes other than heart disease or cancer, compared to individuals with 0 to 1 favorable sleep factors. So clearly tells us that sleep is linked to life expectancy. And this is something that we focus significantly when we're looking at addressing psychiatric disorders. For example, in the ADHD masterclass series that we've just completed, we focus significantly on sleep because we know that individuals with ADHD and ASD have very, very high rates of sleep dysfunction. We're looking at anywhere between 50 to 80%. Therefore, we cannot disconnect the treatment of ADHD and ASD from sleep dysfunction. We know that as part of ADHD management, it's not just medications or stimulants or non-stimulants that make a significant difference. We've got to tag that with lifestyle modifications, and one of the crucial lifestyle modifications is sleep, because circadian rhythm dysfunction is so common, and at the same time we've got to recognize how the circadian rhythm works. For example, the IPRGCs, these are specific photosensitive retinal ganglion cells in our eyes that actually respond to light, and what's interesting is they have dopamine neurons. So therefore, as part of activity, ensuring adequate exposure to sunlight first thing in the morning to regulate the circadian rhythm also provides dopaminergic potentiation. That's just one example, but we've also got to look at the entire sleep phase. For example, in this, you could see they looked at pre-sleep, then they looked at the specific phases of sleep, waking up. They've also looked at whether the individual feels refreshed. Now, coming back to the study, of course, the study has limitations such as self-reported sleep habits. We don't have information about the type of sleep aid or medications used. The researchers suggest, however, that irrespective of this, improving sleep habits overall, identifying sleep disorders, and assessing sleep more often in clinical practice may provide benefits for long-term long-term health, and we as psychiatrists are in the optimum position to make a significant difference to patients' sleep and overall functioning. These findings have been presented at the American College of Cardiology World Congress. The researchers quite rightly suggest that understanding the importance of good sleep hygiene and incorporating a history-taking for sleep habits, the specific phases of sleep and daytime functioning into our clinical assessments may overall improve patient outcomes, but may potentially prevent premature mortality. In conclusion, this is a fascinating and a really important study that links the importance of sleep to life expectancy. Our next bite takes us to a study published in Biological Psychiatry that sheds light on the underlying mechanisms of premenstrual dysphoric disorder, also known as PMDD. Now, PMDD we know is a debilitating condition that is characterized by severe mood swings, severe depressive episodes, anxiety that occur in the 2 weeks leading up to menstruation. It affects approximately 3 to 8% of menstruating individuals. Now, this fascinating study was led by Dr. Julia Sacher from the Max Planck Institute for Human Cognitive and Brain Sciences in Leipzig, Germany. Now, what they did was to use PET imaging, positron emission tomography, to examine the interplay between the serotonin system and estradiol in patients with PMDD, as well as unaffected women over the course of 2 menstrual cycles. And the findings were remarkable. What they found was the brains of individuals with PMDD appeared to increase serotonin transporter density. Now, serotonin transporter, or SERT, is the protein that takes serotonin from the synaptic cleft into the presynaptic neuron. So it transports extracellular synaptic serotonin into the presynaptic neuron. So when there is increased activity or increased density, the overall result is a reduction of extracellular synaptic serotonin. So the imaging showed that patients with PMDD appeared to have increased SERT density from the peri-ovulatory phase, where estradiol levels are high, to the premenstrual phase, where both estradiol and progesterone are decreased. And this increase in serotonin transporter density is correlated with the severity of the depressed mood in the premenstrual phase. Now, in women without PMDD, what the researchers found was a decrease in midbrain serotonin transporter density, which could point to a protective mechanism in the healthy female brain, i.e. women without PMDD. This change in the serotonin transporter density in the midbrain of women without PMDD points to a protective mechanism in the midst of a changing hormonal environment. According to Dr. Sacher, this PET imaging study shows that serotonin transporter density is not a fixed trait, but a state that changes within shorter periods of time. Now, these changes in SERT density could play an important role in PMDD and other types of affective disorders such as seasonal affective disorder. These findings suggest that individuals with PMDD who experience these short-term changes in SERT density as part of their menstrual cycle may actually benefit from SSRIs, selective serotonin reuptake inhibitors, at specific times during the cycle to target these changes in SERT density. We know that selective serotonin reuptake inhibitors, as the name suggests, SSRIs, they block SERT activity, thereby increasing extracellular synaptic serotonin. Using these medications at the specific phase where serotonin transporter density is increased may target these specific symptoms and help treat PMDD. A detailed review has been published on the Psychiatry Hub, so you can check that out. But on the Academy, we're publishing soon a detailed, comprehensive online interactive course on PMDD. Furthermore, we have another one on perimenopausal and menopausal depression coming up as well. In clinical practice, we know that treatment of PMDD with SSRIs can result in a remarkable quick alleviation of symptoms in the order of hours or days. Very different from what happens in depression, where the mechanism is different. It takes approximately a week to 2 weeks for that adaptation to occur. The editor of Biological Psychiatry, Dr. John Crystal, said, "This technically demanding study identifies a new potential mechanism contributing to the negative premenstrual mood states in some women. It also supports the use of SSRIs to treat PMDD." We also know that there are different strategies when it comes to prescribing SSRIs in PMDD. This has been covered in more detail on the psychscenehub.com article, as you can see here. In summary, the findings of this PET study could have a significant impact on the clinical treatment of PMDD, and we hope that studies like this can assist in the treatment of a range of other disorders, psychiatric disorders, where hormonal influences play a big part. We also know that there are gender differences in a range of conditions, including in psychopharmacology. You might remember in the previous edition of Psych Bites, we looked at how when estradiol levels are high, fear extinction occurs to a greater extent compared to when estradiol levels are low. So understanding the influence of hormones in the brain is a significant advance that we hope can improve lives overall. And our final bite is a new public health study by Fred Johansson and colleagues published in JAMA on the 4th of January 2023. This study was conducted over a 9-month period with over 3,500 Swedish university students. This study looked at procrastination and the link to subsequent health outcomes. Procrastination is best defined as a behavior where an individual voluntarily delays an intended course of action despite expecting to be worse off because of the delay. I guess we've all experienced procrastination at some point or the other. We also know that some individuals tend to procrastinate more than other individuals. From a neuropsychological perspective, procrastination has been described as a form of self-regulatory deficit linked to personality traits such as impulsiveness, low levels of conscientiousness, and distractibility. Now, as I said that, many of you are probably thinking when I talked about self-regulatory deficit, we're really talking about the prefrontal cortex and its inhibitory control on the mesolimbic pathway, where symptoms such as impulsiveness arise. A study by Rabin in 2011 showed that procrastinators show reduced executive control, both self-reported and behaviorally measured. They used the go-no-go test, especially where the go-no-go test showed a deficit in the domain of inhibition. Now you can see much of this also links to ADHD, particularly where individuals have impulsivity, and we know one of the symptoms of ADHD that can be quite disabling is procrastination. So let's take a step back to neurobiology. This is something that we've covered in detail on the ADHD Masterclass series on the Academy. A 7.5-hour series of video lectures combined with 5 hours of 2 interactive online courses that gives you a really good understanding of ADHD and its comorbidities. But coming back to procrastination, the prefrontal cortex, and the links to mesolimbic system, we know that the prefrontal cortex operates on a Goldilocks principle. What that means is optimal levels of neurotransmitter are needed for optimal functioning. So which are the receptors that can be associated with procrastination? Firstly, the alpha-1 receptors. We know that the alpha-1 receptors, which are the low affinity receptors that are stimulated by higher levels of noradrenaline, impair working memory. They are important to a certain extent in the initial stages for improving sustained attention and improving flexibility. However, excess alpha-1 stimulation such as conditions of stress or excessive stimulant prescribing or higher doses of noradrenergic agents may actually impair functioning. We know that the alpha-2A receptors in the prefrontal cortex that are high affinity receptors stimulated by noradrenaline are ones that promote working memory, and agents such as clonidine and guanfacine tend to activate this receptor, linking to the treatment in ADHD. But we've got to recognize that dose modulation becomes crucial, and this is where the principle of hormesis comes in, where lower doses provide benefits but higher doses impair functioning. And the second receptor that can be associated with impairment of working memory, procrastination, perseverative thinking is the D1 receptor. We know that the D1 receptor that is stimulated in the prefrontal cortex helps with reward learning, helps in enhancing prefrontal cortex inhibition of the mesolimbic pathway. However, excessive stimulation is associated with a rigid, cognitively inflexible, perseverative style of thinking and action. So now that we understand that and we see that the role of stress plays an important role, here we've got to think about cause and effect. Johansson said that those who tended to procrastinate fared worse over time than their peers who did not procrastinate as much. But procrastinating students were found to be more distressed, anxious, and depressed, amongst many other issues. Procrastination as a behavior has also been linked to higher levels of cardiovascular disease. Now, this study cannot definitively say procrastination causes poor health, because this is a bidirectional relationship. A possibility of reverse causality exists. For example, individuals with depression or anxiety, higher levels of stress, or even cardiovascular disease are more likely to procrastinate because of impaired prefrontal cortex functioning. So this is where reverse causality may be playing an important part. Nonetheless, it raises an important question about the impact of procrastination on people's lives. Chronic procrastination may be associated with impulsivity, individuals worrying excessively, and difficulty regulating emotions. However, the researchers emphasize that procrastinators are not lazy. In fact, they may be busy doing other things than what they're supposed to be doing. So how can one at a population level overcome procrastination and improve our health and well-being? Now, of course, from a neuropsychiatric perspective, we've got to recognize if medical conditions are present, i.e. psychiatric conditions are present, it becomes important to treat that using a biopsychosociocultural diet and lifestyle model. However, there are a number of strategies that can be used to improve prefrontal cortex functioning and to reduce amygdala activation, i.e. reduce stress. Simple strategies such as exercise improves prefrontal cortex functioning and reduces amygdala activation. A walk in nature for an hour has shown to reduce amygdala activity. Good sleep strengthens the prefrontal cortex and reduces amygdala activity. So these are just 3 examples of how prefrontal cortex functioning can be improved that might actually reduce levels of procrastination at a population level. However, at more severe end of the spectrum, we've got to recognize we may need more proactive strategies from a medical perspective. Researchers in this paper suggest that individuals who procrastinate should be kind to themselves and focus on what they need to move forward. One of the strategies may be to take small steps and make progress towards their goals, even if it's just a little bit every day. And this is actually really interesting when you think about it from a neurobiological perspective, because when we think about small steps and achieving goals, this is important because individuals then experience rewards, unexpected rewards. And one of the important ways of stimulating the D1 receptor that isn't stimulated that easily is receiving unexpected rewards. So individuals that procrastinate significantly can be helped by providing them with a different strategy, a strategy where they receive rewards so that their prefrontal cortex connectivity improves through an environment where they're receiving unexpected rewards over time. And receiving unexpected rewards is another way in which prefrontal cortex can be strengthened. As clinicians, it becomes important to assess for procrastination and, if identified, to come up with a range of strategies to assist the individual, for example, setting achievable goals and taking small steps, helping the patient to achieve those particular goals. We can then help the individual overcome procrastination and, of course, improve their overall health and well-being. So with that, we come to the end of this edition of Psych Bites. I look forward to seeing you in another edition soon. Until then, stay curious. Bye-bye.